Should I undergo PRP for hair loss?
Platelet-rich plasma, or PRP, is growing in popularity as a hair loss treatment. Interestingly, until a few years ago, many doctors were openly dismissive about it and its effectiveness for hair loss, since typically they were unfamiliar with it or ignorant of the numerous studies on PRP published in the medical literature. Several recent studies confirmed the benefit of PRP in its effect in stimulating hair growth. Now, many doctors, including those openly dismissive, are now offering PRP injection in their practice. Although I recognize that PRP has an effect on hair growth, I would recommend a different approach along the same line of regenerative medicine technology. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers. This is based on a system we originally developed using PRP and acellular matrix to help improve the healing process and results of hair transplant surgery. Based on this experience, I developed a system which has become a standalone, non-surgical hair loss treatment which has impacted the management of hair loss throughout the world. I would say that our success with this treatment, which we've been doing since 2011, inspired much of the current enthusiasm for PRP. Prior to 2011, I was also an early adopter of PRP technology for aesthetic purposes, such as the treatment of under-eye dark circles, collagen stimulation in the skin for wrinkles and acne scars, as well as improving overall facial glow. In addition, I also have been fairly visible as a go-to authority for media for a specific method of combining PRP with hyaluronic acid filler known as the vampire facelift. Although PRP is proven to stimulate hair growth, as shown in several studies, when you ask many doctors about PRP alone for hair loss treatment, you get different answers about how often the treatment is needed, how long they need to continue with the treatment, and actual examples of how effective the treatment is in their hands. Recommendations for PRP scalp injections vary widely from every 2 weeks to once a month to every 2 to 3 months. Some doctors will also say that after the first few months or after the first year of treatment, regularly scheduled treatments may be needed every 4 to 6 months. The one question that most doctors will be unable to answer is for how long they will need you to continue treatment. This is in part because few doctors have been performing PRP for hair loss long enough to give an answer based on long-term experience. Ask a doctor to show you results of PRP at different points from 1 year to 5 years out, and they will probably not be able to do so. In addition, several doctors claim to have better PRP with higher concentration of platelets, better centrifuges, or more advanced PRP kits, and may charge more for these features. This arms race for centrifuges, in my experience, is not clinically proven or relevant, as I'll explain further. Like any cosmetic procedure, the doctor's specialization and experience matters most. A claim of high level of knowledge and experience should be supported by the doctor's own before and after images of their patients. Unfortunately, some unethical doctors take shortcuts and steal photos and claim them to be their own. In my experience, while PRP alone can stimulate hair growth, in reality, this hair growth is typically short-term and does not sustain growth for periods which go into years. Some people with longer hair growth cycles may see benefits that sustain longer than people with shorter growth cycles, such as those with more advanced hair loss. In practical terms, I feel that any treatment that involves frequent scalp injections is unsustainable. Time constraints and discomfort can quickly discourage even the most highly motivated individual. I often see patients who have given up PRP after about 4 treatments, where they saw limited results, spent a lot of time and money booking and waiting in the doctor's office for their next session, and found that the cost and the pain was too much for them. Speaking of pain, PRP scalp injections are typically done in the doctor's offices without anesthetic, and some doctors state that the anesthetic affects results. As a cosmetic, oculofacial, plastic, and reconstructive surgeon, I strive to make my patients comfortable and to minimize discomfort. It's well known for many years the innovation that originated from our practice, which we developed into TrichoStem Hair Regeneration. The origin of this began when we started using PRP in a material called acellular matrix in 2011 to improve the healing process for hair transplant patients, specifically to improve the healing of the donor area and the hair grafts to improve their survival. Extracellular matrix is an advanced wound healing material harvested from pig bladder for its regenerative properties. A remarkable side effect was observed where a year after surgery, many of these patients' own native hairs, which were not transplanted, became thicker. In TrichoStem hair regeneration treatment, PRP is not the main ingredient. PRP is part of the injection with acellular matrix or extracellular matrix. While the exact mechanism is not quite defined, we believe that the wound healing mechanism has a restorative effect on a deteriorating hair growth mechanism. The results are that the hairs that were present but not growing become reactivated, thinning hair becomes thicker, and the longevity of the hair growth cycle increases. There are several important differences between TrichoStem hair regeneration and PRP alone. These differences include the number of sessions needed, the effectiveness of the treatment, the predictability of results, and the longevity of results. Further, I always emphasize that all genetic pattern hair loss in men and women are not the same. Our treatment is customized to your individual hair loss profile. Factors which affect management include gender, age of onset of hair loss, rate of hair loss, severity of hair loss, and other medical conditions, as well as prior treatments. In our practice, after a full evaluation with microscopic and specifically detailed digital photography, we provide you with a treatment plan. We support the specifics of the treatment plan by showing our patients examples of our own patients so they understand what their unique hair loss situation requires. Every day since 2011, we are treating patients who come from throughout the U.S. and around the world for TrichoStem hair regeneration. Over 99% of men and women with pattern hair loss see visible results with one session of the TrichoStem hair regeneration treatment. In some patients, we do a second treatment after 15 to 24 months. We follow our patients closely every 3 to 6 months for years, depending on the treatment plan agreed upon. In comparison, doctors who perform PRP alone for hair loss estimate that there will be a benefit in about 50% of patients. What motivated me to pursue this approach was the realization that as long as hair follicles are still present and viable, the hair regeneration treatment can exceed the results of a hair transplant. Hair transplantation is limited by the amount of donor hair available and by the safe hair transplant density of about 20 hairs per square centimeter for proper blood supply. Natural existing hair can be present at 50 hairs per square centimeter. This means that if enough thinning hair is present for the treatment to thicken, then the resulting scalp coverage with TrichoStem hair regeneration can exceed the results of not just one, but 2 hair transplants. The treatment starts with drawing blood for PRP. I apply an algorithm based on the individual's hair loss profile to customize the combination of PRP with acellular matrix. The scalp is made numb with a topical and local anesthetic, so there is minimal discomfort during the actual treatment. The prepared hair regeneration serum is dosed by me and injected into the scalp. While preparation can take 1 to 2 hours, the treatment is performed in a few minutes. There may be some tenderness in the scalp afterwards, and most patients return to work the day after. We treat many patients who fly in from around the world every day for the TrichoStem hair regeneration treatment, and some actually fly back home the same day as the treatment. Genetic pattern hair loss is hardwired in the DNA and will still progress. Neither what we do or any other treatment is a cure. I emphasize to my patients that hair loss is managed, and I do use other modalities to help my patients for the long term. The benefits of TrichoStem hair regeneration can begin to be seen as early as 1 to 3 months. In our experience, the scalp coverage does continue to improve for 15 to 18 months before there is a stable appearance. PRP alone for hair loss does have proven scientific basis. Our TrichoStem hair regeneration system using PRP and acellular matrix treatment has been consistently successful since 2011, with only 1 to 2 treatments with benefits lasting for years. Based on extensive experience and analysis of individual patients' clinical data, I further developed a hair loss profile system with customized treatment plans. I would say that the current limitations of knowledge and experience by practitioners and the challenges with treatment frequency, discomfort, expense, and predictability makes PRP as a standalone treatment not the optimal choice for hair loss treatment. I hope you found this information helpful. Thank you for your question.